Certified registered nurse anesthetists have been anesthetizing patients for more than 150 years. We are advanced practice nurses who have completed an average of 8 intense years of education and training that qualifies us to provide any type of anesthetic in any setting in which anesthesia is delivered.
In Missouri, this is especially important since 33% of its population resides in rural counties. And of those rural counties, more than 75% of the anesthesia services that are delivered by solo practicing CRNAs. So without CRNAs, more than 1.5 million patients are left without access to health care.
I'm Dr. Cavello, board certified in general surgery as well as peripheral vascular surgery. I've practiced for over 25 years. The majority of cases I've done have required anesthesia, and this has been provided for the most part by CRNAs acting independently without supervision of an anesthesiologist. I have found that there is no difference in the quality of the anesthetic given by a CRNA compared to that of an anesthesiologist. And in fact, there is statistically no difference in outcome between the two schools.
Research shows that CRNAs are the most cost-effective anesthesia provider with an exceptional safety record.
Many times healthcare facilities will hire an anesthesiologist to supervise CRNAs in an effort to manage the risk, but then they can more than triple the cost in anesthesia delivery, all while not improving patient outcome, lowering risk, or reducing liability coverage costs.
Our company works both in Kansas and Missouri. In Kansas, there's no real supervision requirements, and we work independently with the surgeon. But when you cross state line and you go to Missouri, we're faced with so many meaningless restrictions and are supervised by the surgeon, which that puts a lot of pressure on the surgeon that they really do not want, and it can really get in the way of patient care.
It is interesting that in Missouri, state law requires supervision of a CRNA by a dentist, surgeon, or podiatrist, despite the fact that these practitioners have no in-depth training in anesthesia. In fact, any intraoperative intervention by these practitioners could be hazardous to the patient as well as increase their liability.
The most amazing part of my job is the ability just to take care of patients, have one patient to really focus on and take care of. And that's what I love best about my job.
So given the knowledge that CRNAs are equally as safe and the most cost-effective, it really only makes sense that we allow them to practice to the full extent of their training and education in Missouri. Especially in light of the fact that Missouri is ranked 37th out of 50 in patient access to health care. We can do better than that, and we will.
CRNAs simply need to be allowed to practice to their level of training and education without supervision.